So, Dr. Mayoni, I absolutely loved your kind of panel talk today. You know, you're the Vice President of the British College of Functional Medicine, and this is what we're talking about, you know, the future of the patients. So tell us a little bit about your history, because you haven't always been in functional medicine, have you?
No, I am very much an allopathically trained doctor, so that means I went to medical school in the UK, I did all the things. I did a BSc in the middle of my medical school training and then left, became a surgeon. I did a PhD in the middle of my surgical training as well, and really went on and completed that training with a view to be a colorectal and pelvic floor surgeon. So that's where I started.
Okay, so I've got a question here that we want to ask. So, because it's all about, you know, how we're going to improve healthcare, really. So, what does future-proofing of health mean to you personally and professionally?
Future-proofing, I think, really is about understanding your personal genetics and how they interact with your environment. And this is what we call epigenetics. That conversation is really powerful because we can actually influence it in a good and a bad way. So we're probably all used to kind of knowing about how eating rubbish food can make you feel more ill. The truth is we can actually make our genes really amplified by eating really well. So our genetics are a big part of it, understanding how to make that work, looking at basic lifestyle manoeuvres, sleep, movement, reducing toxic substances, stress management.
Is this why your skin just looks so perfectly clear, doesn't it?
I try and do, not being funny, so genetically I'm Sri Lankan. I've done all the things that I ask my patients to do, and I look after my skin, so...
Yeah, and it's proved because, I'm very much into the biohacking kind of side of things, and I love functional medicine. We were here today and it was, I wouldn't say a heated argument, but there was different opinions, because I suppose not everybody believes in functional medicine. It's almost like they want to go and have a quick fix, and kind of numb that pain. What's your opinion on that? And what do you want everybody to kind of, I suppose, think about functional medicine?
I think for me, there is a place for everything. And, conventional medicine, well, this is allopathic medicine as we now know. Medicine of the last 200 and 250 years has evolved out of necessity to try and help manage a symptom. And that's fine. There is a place for it. There's a place for everything. And we've got structures that help people to do that. But the reality is the vast majority of people have got chronic conditions, or they've got things that they're not aware of even yet, and they need help navigating their health. They need to understand how they can use their genetics, how they can use food, and all the things we talked about to optimise their health. So really putting into that what I call their health pension. What does that look like?
Okay, so we're talking about epigenetics, about, maybe your ancestors and what, how you carried on that gene. What is it that you guys really do? How would people find out if they had a chronic disease without actually feeling like they've got one?
Yeah, so I think first of all, for me, it's taking a really good history. This is the history that I learnt as a medical student. Yeah. So I literally want to know about your inside leg measurement, your dog's name, how often you go for a walk, how many times you do a poo, really. All of those things are really deep pieces of information that I can start to build a picture of your current health and your longer term health, because your health is not just what happened to you today. Yeah. It is, and unfortunately lots of people kind of come to me going, oh, I'm suddenly feeling really unwell. And actually the reality is, unless you've had an accident, most
probably
people
been feeling like that for a while.
A long time. It's a build up of things that we need to unpack and find out.
Okay, so I briefly heard earlier that there's lots of people kind of underneath you within the functional medicine kind of world. How are you working with them, and what's the message that you want to kind of put out there?
So we've got the BCFM was set up to really help doctors practice functional medicine in the UK, and we are aligned with many other allied professionals in this sort of world. We've got fantastic people in the ecological medicine space, people in BANT, which is the British Association of Nutritional Therapists. We work with osteopaths and chiropractors and people within really what has just always been described as the alternative health space, which is slightly, I find, offensive because it always sounds like it's a kind of backup option. Whereas for many patients, they are navigating the world of Google and this holistic space on their own with no support, and they go to their healthcare provider and they have no support because they're not well informed enough about the options. And a lot of healthcare providers do want to help, but they don't know where to go. And we want to be that resource. We are that space where they can learn and read about it.
Well, listen, it's fascinating. So thank you so much. Keep doing what you're doing.
Thanks, lovely.
Thank you.
Thank you.